Bhatta, a second year student of Lyceum Northwestern University. May I please know your name?
Vinay Kumar Bhatta.
Okay, Mr. Vinay, throughout the exam, if you feel any discomfort or uneasy at any point, please let me know.
Okay.
So when the patient was coming in, I observed that the motor gait and the motor activity was accurate. And when he sat, his posture seems to be accurate, that is, he's sitting properly. And he seems to be in good hygiene. The dressing is appropriate, and there are no body odors or breath odors. So I observed that the patient seems to be in a good mood. I could tell that through the manner of speaking, and from the facial expressions, I could tell that the patient is not under any stress. He seems to be relaxed, and whatever data is provided by you throughout the examination and whatever data is collected by me throughout the examination is going to be completely confidential. So please feel free and be transparent with me and give me accurate data.
Okay.
Now, Mr. V, I'll be asking you a couple of questions. Please answer them. Which day of the week is it?
It's Saturday.
Okay, and what is the name of the building?
Alexis,
Okay, and why are you here today?
we have a general survey.
Okay, and throughout your body, do you feel any pain or discomfort anywhere?
No, not
Okay, so through these questions, I observed that the patient is alert, that is, he's in consciousness, and he's oriented to the place and time, and he's coherent, and also he doesn't seem to be in any distress, that is, there are no signs of distress, and the patient seems to be healthy. Now I'll be calculating your height, weight, and body mass, the body mass index and the waist circumference. Can you please stand over there? Please stand straight. Okay. Okay, we move forward. It is 176 meters. And can you please step on this weighing machine? Okay, you sit. The weight is around 66. The body mass index will be 21.3. It's in a normal range. The normal range is 18.5 to 24.9. Now I'll be measuring your waist circumference. Can you please stand?
Check left one,
Is it alright if you lift your t-shirt? So generally, to measure the waist circumference, we need to measure it. First, there are two borders that we need to consider. One is the lowest margin of the lowest rib, and then second is the highest crest of the hip bone. So, can you please lift your t-shirt? So we'll be measuring it over here. You can breathe out, it's okay, but don't take your stomach inside, okay? Okay, it is 34. We'll be considering the Asian standard. So for men it should be more than 34 inches. It seems to be appropriate. Now we'll be moving on to the vital signs. Mr. V, I'll be measuring some of your vital signs. So first I'll be measuring your BP and then the pulses and respiratory rate. So is it alright?
Yeah.
Okay, first I'll be measuring BP through the cuff. It's a non-invasive procedure. So please be relaxed, okay? Can you keep your hand over here? Yeah. So the position of the arm should be abducted, slightly flexed at the elbow, and it should be on the heart level. Should be above the brachial artery, and it should be around 2 to 3 finger length above the cubital fossa. And we should make sure that the cuff is neither too tight nor too loose. Mr. B, is it too tight?
No.
It's okay. So first I'll be measuring the radial pulse, and when I palpate for the radial pulse, I inflate the cuff and I will note the point where the pulse disappears. Okay. So at 120, the pulse disappeared. So I will inflate 30 mmHg to that value. So I will inflate it to 150, and I will measure after that. And I will auscultate over the brachial artery. I will deflate it around 2 to 3 mmHg per second. The pulse appeared at 130, so which is a systole, and then it disappeared around 80. So the BP is 130 over 80. And after 2 minutes, I did the same procedure on the other hand, and the values were approximately same. So since the difference is not greater than 5 mmHg, we can consider this, and the BP is in normal range. Checking for the radial pulse for over a minute. Can you please put your hand over here? I will measuring your radial pulse. It's around 70. The general normal range is 60 to 90, so it's a normal range. Now I'll be checking for respiratory rate. That is, I will check for the movement of the chest wall. I'll be doing this for a minute. Okay. So it's around 16. The normal range is from 12 to 18. So this is around the normal range. Mr. V, I'll be checking your temperature now.
Thanks.
Can you please place it in your axillary region?
Yeah, okay.
It's 37. The normal range is around 36 to 37, so it's normal. Now I'll be checking for your oxygen saturation.
Yeah.
Please. It's 98. It's normal. I'll be examining the skin. So firstly, I'll be looking for the moisture of the skin. Looking at the patient, I can say that he is well moisturized. That is, the skin is not too dry or flaky. And next, I'll check for turgor. Can you please give me from your hand? It's normal. It shows that the body is hydrated well. And now I'll be checking the skin. The skin color seems to be normal for his ethnicity. There are no lesions or scars. There are no plaques or any suspected moles. And now, can you please show me your nails? I'll be looking at his nails. There is no discoloration or bruises. The nails are not brittle. And there is no clubbing or pitting of the nails. There is no cyanosis. The nails and the nail bed seems to be healthy. Now I'll be looking at your hands and feet. Can you please, I'll be inspecting them now. Can you just show me over here? The skin color seems to be normal, there's no redness. And the hair distribution is even. There are no lesions or scars. So it's normal, the skin is normal. Now I'll be proceeding to the heat examination. Is it alright or do you need some time?
No, is it?
It's okay? So now I'll be examining the head, eyes, ears, nose and throat of the patient. Firstly, we'll start with head. First, I'll be inspecting the patient's hair and scalp. Is it okay if I touch it?
Yeah.
The hair distribution seems to be normal. There are no balding spots. There are no bald spots, and there's no redness. And the hair color seems to be normal, and the hair texture is also normal. It's not too brittle. Now I'll be examining the scalp. Do you feel any itchiness?
No.
There's no dandruff. There's no redness or.
Okay.
There are no scars. The scalp seems to be normal, and now I'll be checking for the face and the head's contour and symmetry. Is it okay if I touch your face? Can you please remove your spectacles? It's symmetrical. Now I'll be checking for the cranial nerve 5's function. So it is generally used to test the facial sensation to light touch and temperature. So now I'll be touching your face with an object. No need to worry. Just close your eyes, and once I'm done, I'll ask you to localize it. Like where did you feel the sensation? Okay. Please close your eyes. Okay, that's good. It's accurate. And how was the object? Was it warm or cold?
It's cold.
Yeah, it's a little cold than room temperature. Now I'll be testing for cranial nerve 7's function, that is the facial symmetry. Please follow my instructions.
Okay.
Can you please close and open your eyes 2 times? Slowly. So they're both opening at the same pace and time. The symmetry is good. And can you raise eyebrows? Okay, as we can see, it's symmetrical on both the sides, and we can also see the forehead wrinkles. And now can you smile for me? Ear to ear. Yeah, so the smile is also symmetrical. And can you do... The puffiness of the cheek is also symmetrical and similar on both the sides. And now I'll be examining the eyes. In that first I'll be examining for the cranial nerve 2's function. In that first I'll be examining for visual acuity. So, Mr. V, there's a Snellen's chart on the wall. I want you to remove your specs. And can you please close your left eye? Yes. And can you read whatever you, from the last, whatever number you can read, can you please say it out?
I can read 0, 2, 7, 6, 5.
Okay. Can you please close your right eye?
6, 5, 8, 2, 0.
So the visual acuity is good. Now I'll be observing for the visual fields. Can you please remove your glasses? I'm positioning, can you please move to that? I'll be positioning myself 2 feet away from the patient, and I'll be moving my fingers like this. Whenever you can spot them. Whenever first you spot them, please let me know, okay? I'll be observing in the 2 temporal fields, that is the upper temporal field and the lower temporal field. Okay?
Now I can see. Now I can see.
Okay. The visual fields are good. So the cranial nerve 2's function is intact. Now I'll be inspecting the external eyes. Can you please remove your glasses? The eyes shape, position, alignment, and can you please move your eyes, move your gaze that side and this side. The symmetry is also good. Now I'll be examining the eyebrows and eyelids. Close your eyes. Can you please raise your eyebrows? They are raised symmetrically. And can you please open your eyes? Look up. There are no nodules or redness of any sort. And can you please close your eyes? Open your eyes. The eyelids are closing properly. There's no defect in that. And the direction of the eyelashes is also as it should be. Now I'll be examining for the conjunctiva and sclera. I'll be holding your lower eyelids. Is it okay? Kindly look up. And look from the look front. There's no dryness or tearing. There are no nodules or there's no redness or swelling of any sort. Now I'll be examining the cornea and lens. I'll be using this light obliquely through his eyes. It seems normal. There's no glaucoma or anything. Now I'll be examining for the cranial nerve 3, 4 and 6. First I'll be checking the iris and pupil. The size and shape is normal. Can you please look that side and down? And the movement is symmetrical also. And now I'll be checking for pupillary reflexes and extraocular movements. I'll be standing at 2 feet of distance from the patient. Can you please look into this light? I could see the reflection in the cornea. Now I'll be checking for the gaze. I'll be moving my finger. Please follow the finger, okay? I'll be moving it in the 6 cardinal directions of gaze. Follow my finger. There's no lid lap or jerking, and there's no deviation from normal. So it seems normal. Can you please look there at that point? There's no nystagmus or there's no ptosis. When using an ophthalmoscope, we set the lens disc to 0 diopter and we stand in front of the patient and ask the patient to look over our shoulder. And when examining the patient's right eye, we use our right hand and right thumb and we examine in this way. And when observing the patient's left eye, we use our left hand and left thumb to examine the patient's eye. And now I'll be checking for red-orange reflex. I'll position myself 15 inches away from the patient. Can you look? To examine the red-orange reflex, we use an ophthalmoscope. And when using an ophthalmoscope, first we need to set the lens disc to 0 diopter. And when I'm examining the patient's right eye, I need to use my right hand and vice versa. So I need to place myself 15 inches away from the patient. And when I look into his eye, I need to find a red reflex in his pupil. That is a normal finding. And along with it, I need to also observe the optic disc if there are any spots. Generally, there should be no spots. And also retina and retinal vessels for the drainage. Now I will be proceeding to the ear examination. So firstly, I will be observing the external ear and auricle. Is it okay if I examine your ear? This is normal. I'll check on both the sides. So there is no redness or lesions or any dry flakes. It's normal. Now, when we use an otoscope, there are a couple of things we can do to make the examination easier. First is we have to choose the greatest speculum that's available of the otoscope, so that will be easier. And second is the position of the head of the patient. We can position it in such a way that the examination will be easier. Can you please tilt your head a little? And next is to straighten the canal, which will ensure the easy passage of the otoscope. We can pull the auricle upward and backward. This will ensure an easy passage. And then, so now we'll examine the auditory canal, the tympanic membrane, and the cone of light. Also, with this we can also examine for any foreign particles, earwax, or if there is any bleeding, or if there is any discharge, swelling, or redness in the ear, we can easily detect from this. Okay. There's nothing, it's completely normal. Now we'll test for cranial nerve 8. So this is to test for the hearing acuity. So now I want you to close one of your ear, and on the other ear I'll whisper something from 2 feet, 1 or 2 feet of distance, and please tell me what you hear. Okay?
Left hand.
Okay. And can you please close that ear?
22.
Okay. As we can see, the patient's hearing acuity is good. But what if the patient's hearing acuity is diminished? What do we do in those cases? We have 2 tests to either confirm or diagnose the hearing problems. The first is Weber test. In this, what we do is we use a tuning fork and place it on the patient's forehead, and we ask where is the sound lateralizing to. So assuming that the patient's hearing acuity is diminished, let's do it. Which side do you hear the sound?
Both the sides. I can
Okay.
hear from both the sides.
So this shows us that the patient's hearing is good. Generally, in a normal test, the patient should be able to lateralize the sound on both the sides, or he should be able to hear it medially. So his hearing is good. Now, second test is Linnaeus test. In this, we place a tuning fork on the mastoid bone, and we have to ask the patient that once he can't hear it anymore, he has to tell us. So once he tells us, we need to quickly move it near the ear, so that we need to ask him if he can still hear it or not. Now I'll be placing this on your mastoid bone. Once you stop hearing it, please tell me. I'll place it near your ear and tell me if you can hear it or not. Okay?
Okay. I can't hear anymore. I can hear.
Good. So this shows us that the patient's hearing is good, because generally the air conduction is more than bone conduction. So that means that when we keep it near the ear, he should be able to hear it. So this shows that the hearing is good, and this should be done on both the sides. I checked for both the tests on both the ears, and the results are good. Now I'll be examining the nose. First, I'll be checking the anterior and inferior nose. I'll be gently pushing it. It seems normal. There are no lesions or discoloration. Generally, we use an otoscope to examine the nasal mucosa, but I'll be using this light. I'm checking for the nasal mucosa. The color and condition of the nasal mucosa is good. Generally, the nasal mucosa is a little redder than the oral mucosa. And now I'll be inspecting the nasal septum, inferior and middle turbinates. There is no deviation or perforation. There are no visible ulcers or polyps. There is no inflammation or swelling. So this is normal. Next, I'll be checking for frontal and maxillary sinuses. I'll be checking for your frontal and maxillary sinuses. If you feel any pain or discomfort, please let me know. Can you please remove your specs? First, I'll be checking for the frontal. Do you feel any pain or discomfort? Now I'll be checking for the maxillary. Do you feel any pain or discomfort? This shows normal findings. And now I'll be checking for cranial nerve 1's function. Can you please close your eyes and smell this and tell me what do you smell?
I smell coffee.
Yes, I sprayed a coffee perfume. The cranial nerve 1's function is intact. Now I'll be examining the mouth and pharynx. First, I'll be examining the lips. Can you please look at your lips? The lips are symmetrical. It seems to be properly moisturized. There's no dryness or flaky lips, and there's no cracking. Can you open your mouth? There are no ulcers or polyps. Now I'll be examining the oral mucosa. I'll be using this for proper lighting, and this as a tongue depressor. Can you please open your mouth? The color seems to be normal. Okay. There are no ulcers or polyps, and there's no white discoloration, that is, there's no infection present. It's normal. Examining the gums, teeth, and hard palate. Can you please open your mouth? Okay now. So the color of the gums is normal. There's no discoloration, and even the margin of the gums, even in the margin of the gums, there's no discoloration. The color is normal, and now I'll be observing the teeth. Can I? Okay. There's no missing tooth, or there's no abnormal position of any tooth. There's no discoloration. There are no cavities. The teeth seems to be normal. On examining the teeth, I observed that there is no missing tooth, or there is no abnormal position of any tooth. The color seems to be normal. There is no discoloration, or there are no cavities or dents present, and the shape of the tooth is normal, and there is no missing tooth. Observing the tongue and the floor of the mouth. Can you take your tongue out? The tongue's color seems to be normal. It's symmetrical. Now I'll be examining the dorsal side and the inferior side of the tongue. Can you just open your mouth? Can you lift your tongue up? There is no redness or indentation, and there are no polyps or ulcers, no inflammation. The mucosa seems to be completely normal. I'll be checking for the cranial nerve 12, 12's function, that is the motor function of the tongue. Can you keep your tongue outside and move it side to side? Okay, it's good. And can you touch the roof of your mouth with your tongue? Okay. Now I'll be checking for the pharynx. Can you open your mouth? Place your tongue on the floor of the mouth. Okay. Now can you say ah?
Ah.
Say it for 5 to 6 times. Okay. The patient's uvula is in the midline, and the soft palate was moving symmetrically, both the sides. So this is normal. And I observed that there are no tonsils, no ulcers, there's no redness. So it's normal. Now we'll be moving on to the examination of the neck. First I'll be palpating for the lymph nodes. Is it okay if I palpate? I'm palpating in the preauricular region, posterior auricular, submandibular, submantle, tonsillar region, and supraclavicular, cervical region, superficial, deep. Okay. Now I'll be checking for the tracheal deviation. I'll be checking between the sternum mastoid and the trachea. Can you please lift your head? symmetrical on both the sides, so there's no deviation. And now I'll be inspecting the thyroid gland. Can you please sip it? Don't swallow it. Okay, and swallow it when I tell you to. Can you please, yeah. And now can you swallow it? Okay, the movement is good. Now I'll be palpating the thyroid gland. Can you please sip a little water and don't swallow it? Is it okay if I touch? Just bend your head a little bit. Swallow please. The movement is normal. Now I'll be checking for cranial nerve level. So just shrug your shoulders. Yeah, sit straight. Shrug your shoulders, and I'll be trying to move your head towards one side. Try to resist it. Put opposite pose. Okay. Shrug your shoulders. Okay. Shrug your shoulders. The cranial nerve levels function is intact. We'll proceed to the thorax and lungs examination. For the coming exam, you need to remove your upper garment. Is it alright?
Yeah.
Okay, I'll go outside. Please change and you can use this strip.
Okay.
I'll be draping the patient. Now I'll be examining the posterior thorax. As we can see, the back is exposed and I'm taking the midline position behind the patient. First, I'll be inspecting the back. It is symmetrical. There are no deformities. The contour is good. There are no lesions or visible scars, edema, redness or anything. It's normal. Now I'll be palpating the spinous processes for tenderness. I'll be using my thumb. Can you bend your head? If you feel any pain or tenderness, please let me know.
Yeah.
Okay, there's no tenderness or any pain. Now I'll be assessing the shape and movement of the chest wall. I'll be placing both of my thumbs at the level of 10th rib and I'll see for the movement of the chest wall. Can you please inhale deeply? Exhale. Inhale deeply. Exhale. As you can see, my thumbs are moving symmetrically on both the sides. I'll be palpating for tactile femmitus. Can you please say 99 continuously until I will stop? Please say.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. I could feel it on all the surfaces of the back. Now I'll be percussing the posterior thorax. Can you please cross your arms in front of you? Yes. Now I'll be percussing in the 7 areas. It is resonant. Generally, it should not be either hyporesonant or it should not be dull. So this is normal. Now I'll be auscultating the posterior thorax in the same 7 areas. Can you breathe deeply through your mouth?
Mouth.
Can you please say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
I observed that the breath sounds are normal, and also hearing the voice of the patient is abnormal, but I didn't hear any patient's voice while doing this. And there were no other adventitious sounds too. There were no wheezes or rails or anything as such. So this is normal. I'll be examining the anterior thorax and chest of the patient, and I'm draping the patient only to expose the areas that are needed for the examination. I am acquiring the right side position of the patient. The patient is supine. So first I'll be looking for the shape and movement of the patient's chest. As he is inhaling and exhaling, I can see that the movement of the chest wall is symmetrical on both the sides. Now I'll be inspecting for tactile femmitus. Can you please say 99?
99,
Is it okay?
99, 99,
I'll
99,
be using the ball of my hand to examine.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
I could hear the voice. I can hear the. I could sense the vibrations equally on all the areas that I palpated. Now I'll be percussing. I'll be percussing the anterior and lateral chest. I could sense the heart's dullness from third to fifth intercostal space, and rest it seems to be normal. Now I'll be auscultating. Can you please breathe through your mouth? Can you say 99?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Yes. I could hear normal breathing sounds. There were no adventitious sounds, no rales or wheezes or anything. And I could also not hear the patient's voice through the examination. So it's all normal time. Now I'll be moving towards the cardiovascular examination. So the patient is in supine position with the upper body elevated to 30 degrees. I am acquiring the patient's right side, and as we can see, the patient I have taped the patient just viewing the precordium. Now I'll be measuring the jugular venous pulsations in. Now I'll measure the jugular vein pulsation in the reference to sternal angle, and I'll measure it. I'll be using a rectangle object and a measuring device. I'll keep it at the sternal angle. I'll measure it from the point of pulsation. It's around 2.5 centimeters. This is a normal value. It should not be greater than 3 or 4 generally. And also, if we observe in hypervolemic patients, we get the angle even as high as the jaw, and in the patients with hypovolemic conditions, the pulsations even come down to the sternal angle. Now I will inspect, palpate and auscultate for the carotid pulsations. This provides us a valuable insight on if there is any valvular heart disease or aortic stenosis. First I'll be palpating. I'm measuring the amplitude and upstroke of the beat of the pulse. Now I'll be auscultating. I'll be using the bell of the stethoscope. There are no bleeds from any turbulent blood flow. So, as you can see, I inspected on both the sides. I palpated and auscultated on both the sides. Now I'll inspect the precordium. There are no heaves or lifts. Now I'll be inspecting for the apical impulse. There is no diffuse or tapping sounds. Now I will palpate if there are any thrills. I'll use the ball of my hands. There are no thrills. Now I'll see for the pulse of maximal impulse. And when we do the examination in women, we gently ask them to displace the breast laterally or upwards, and we perform the examination. here. Okay, now I'll inspect for the right ventricular upstroke from the left sternal border. I'm auscultating in the third, fourth, and fifth interspaces. There are no abnormalities. Now I'll auscultate the heart in the 5 impulse points. I'm auscultating in the second right intercostal space. This is for the aortic pulsations. Now second left intercostal space. I'm using the diaphragm of the stethoscope. This is for the pulmonary pulsations. In the third left intercostal space. This is for Erb's point. Now I'll be inspecting for in the fourth intercostal space for tricuspid pulsations. This is along the sternal border. Intercostal space for mitral pulsations. This is around the mid-clavicular line. Everything seems normal. There are no abnormal sounds that can be heard. Now I'll be examining the abdomen. As you can see, the patient is in supine position with arms at his side, and I'm acquiring his the position of. I'm acquiring the right side position of the patient, and as we can see, the drapes are in a way that the abdomen is exposed till the pubic symphysis location. Now I'll be inspecting the abdomen. The shape seems to be normal. It's flat. There's symmetry. There are no deformities. There are no scars, and the contours are good. There are no lesions or anything. It's normal. Now I'll be auscultating the abdomen. I'll be using the diaphragm of the stethoscope. I'll be auscultating in the 4 main quadrants of the abdomen. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Now I'll be auscultating to listen to the aortic brood just above the navel in the midline. There are no glutes, it's normal. Now I'll be percussing to measure the liver span. I'll be using the mid-clavicular line. I'll be percussing along it. Okay, I can feel the dullness. It's resonant. That is the lungs pressure. Now I'll measure this. Okay, it's around 10.2 centimeters. This is within the normal range. Now I'll be percussing the spleen. First, I'll be focusing in the anterior axillary line. Okay. Now I'll be focusing laterally. Do you feel any tenderness? Okay, there's no splenomegaly. Now I'll generally percuss the abdomen. There's no splenomegaly or anything. Now I'll be palpating the abdomen. I'll be palpating in the four quadrants first. First I'll be using a light motion, then I'll be using deep palpation techniques. Please let me know if you feel any pain or discomfort. Do you feel any tenderness? Now I'll be inspecting the suprapubic region. Please let me know if you feel any pain. Now at the epigastric region. Now I'll be using a deep, firm dipping motion in all the four quadrants again. Do you feel any tenderness?
No.
Now I'll be using the hooking technique. Please take deep breaths. Okay. Please take deep breaths. There is no hepatomegaly or anything, it's normal. Now I'll be palpating the spleen. I'll be using my left hand under his abdomen in order to push the lower ribs upward, and I'll be trying to palpate with my right hand. Please deep breathing. Okay, there's no splenomegaly. Now I'll be checking for the costovertebral tenderness. Please let me know if you feel any pain or anything. I'll be using the fist of one of my hand and the palm of one of the hand. Do you feel any tenderness? Okay, now I'll be examining the extremities. First I'll be looking for the pulses. I'll be checking for the popliteal pulses. Okay. I'll be checking for the dorsalis pedis pulses. Okay, on the other leg too. Now for the tibial femoral pulses. Okay. this is normal. Now I'll be looking for edema. There's no pitting edema. There's no edema. And can you stand up? Can you turn? Okay. There are no varicose veins also. And there are no deformities on inspection. And I'll be inspecting for the joints now. Please let me know if you feel any tenderness, okay? There are no enlarged joints. It seems normal. Now I'll be assessing the motor function of the extremities. Can you extend your leg? Both the legs. Okay, and hands? Can you just and do this? Okay, and can you also move this one? This leg. Okay, now I'll be try to force your extremity against my resistance. Okay. Yeah. Okay. Can you extend your arm? Resist it. Okay. Okay. So the motor function is good. Now I'll be checking for the sensory function. Now I'll be touching these two objects on your extremities. Please close your eyes and please let me know when you feel a soft touch and when you feel a hard touch, okay?
Hard touch. Soft.
Yes.
Hard. Hard. Soft. Hard. Soft. Hard. Hard. Soft.
Can you extend your arms?
Hard. Soft. Hard. Soft. Hard.
Can you extend the other arm?
Hard. Soft. Soft. Soft.
Okay. The sensory is also completely fine. Now I'll be checking for bicep tendon reflexes. Can you do this? Okay. Now relax your hand. Okay. Can you do the same? Okay, relax. Okay, that's good. Now I'll be dropping it on your knee. Okay. Okay. This is normal. Now I'll be checking for coordination and cerebellar functions. I'll be placing my finger over here. With your finger, can you touch your nose and then my finger? Okay, again. Again. Okay. Now close your eyes and touch your nose with your finger. Okay. And now, can you please touch your heel to your shin? Okay. And the other leg? Okay, that's good. Now I'll be checking the gait. So can you please walk normally first? Okay. Now can you walk from your heel? Okay. Now can you walk through your toes? Okay. It's completely normal and the results are completely normal. Thank you, Mr. V, for coordinating and being completely honest with me. Thank you so much.
Thank you.